Embedding. The impregnated tissue now has to undergo embedding. For embedding the tissue in melted paraffin, metallic molds are used. At first, lubrication of the metallic molds is done by liquid paraffin. After that, melted paraffin is poured in and the tissue is carefully embedded in proper plane at the bottom of the metallic molds. It is important for technician to have a sound knowledge of basic histology and tissue orientation to be able to embed in the correct plane so that all layers of tissues can be visible on the slide. The melted paraffin is allowed to harden at the room temperature. After hardening, the metallic molds are removed and the blocks are properly trimmed. Then, the blocks are kept in the ice chamber of a refrigerator for some time before cutting the sections. Trimming, sectioning and labeling. Trimming is done to remove excess wax from the blocks until tissue is fully exposed. Then, boundaries are cut manually to decrease the size of the section. Before starting the sectioning, the wax blocks with embedded tissue are rubbed with ice. The microtome is used to cut tissue sections 4 to 5 micrometers thick, one tissue block at a time. The microtome is nothing more than a knife with a mechanism for advancing a paraffin block standard distances across it. The setting of the microtome, indicating the tissue thickness, should be checked before use. The important necessity for proper sectioning is to have a very sharp knife. Each block of tissue is fitted in the microtome machine. Sections are cut at 4 to 5 micron thickness. Ribbons of good sections are selected and floated and flattened on lukewarm water in a water bath. Temperature of the water bath should be maintained at 50 to 55 degrees centigrade, which is around the melting point of the wax. The flattened tissue sections are placed on clean albuminized labeled slides and dried on the slide warmer. Slide warmer temperature is kept at 70 degrees centigrade and should be checked daily. If slide warmers are not available, the slides are kept in inclined positions to drain off water and allowed to dry at room temperature. Labeling is an important step and must be done with great care and clearly with a diamond pencil. Steps of hematoxylin and eosin staining. Different labs may follow different staining procedures. Each procedure needs to be standardized as per requirement. Maintain and upgrade your SOPs periodically. Now, stain the slide with hematoxylin stain for 15 to 20 minutes. Again, place the slide under running tap water for 5 minutes. Next, dip the slides for a few times in 1% acid alcohol for decolorization. Place the slides under running tap water for 15 minutes or till the sections turn blue. Counterstain the slide with 1% eosin stain. Again, immerse in water for 1 minute. The next step is dehydration, which is done by immersing the slides in ascending concentrations of alcohol. Dip the slide 2 to 3 times, first in 90% and then in 100% alcohol. The slides then need to be cleared in xylol. This is done thrice for 2 minutes each. Gently wipe the back of the slide and around the tissue section after each change. Now, mount the slide with DPX. Place some amount of DPX on the tissue section and place a cover slip on it. Remove air bubbles by gently pressing with a forceps. Wipe the excess DPX with a tissue. The slide is now ready to be viewed under the microscope. The nuclei of the tissue stain blue, while the cytoplasm stains shades of pink to red.
Hello, everyone, and welcome to the last days. It is an honor and privilege to be here. I hope that my feed is not as bad as it's looking right now. Hopefully, it's going to catch up. I was just thinking as I watched that opening today how far we've come. Some of the opening screenshots are from many, many interviews as we have tried to navigate the COVID crisis in our globe, on our globe. And there's been a lot of deception and a lot of things we've had to try to figure out, and a lot of things that were really hard to figure out. And some of the key people that help us to get to the bottom of it are heroes. Heroes who maybe by accident discover certain things that help us to clarify what this is all really about, what COVID's about, what the vaccines are about. And these people that dare to come forward, they are truly the heroes of the land. And I'm just so happy that we get to do this and discover this together. I'm grateful for all of you. Thank you very much for your wonderful supporting emails that you've been sending me, knowing that I'm on a very, I would call it a brutal trip of excitement, but a lot of work. So our days are probably pretty much 13-hour days right now of editing. We go to conferences, we get footage, we interview people. This coming weekend, we will be interviewing Dr. Yeadon, former Pfizer executive, and Dr. David Martin. And that should be absolutely fascinating to find out their roles in everything. Many of you have seen some of the incredible information that they've brought forward. Today, we have incredible guests, and some of this information came about by accident in a way, or so to speak, that it wasn't something that Dr. Arne Burkhardt thought he would discover or knew that he would discover. What happened was he was asked if he would do autopsies because there were family members of the deceased that had questions and concerns and didn't always feel that they had the answers. And along came an incredible coroner, a pathologist, Dr. Arne Burkhardt in Germany, who began to do some work that is revolutionary. And he's going to bring it to us today. And along with him is Dr. Michael Palmer, and he is going to join us, and we are going to have a discussion on some of the findings of Dr. Burkhardt. So please, gentlemen, welcome to the show. We'll bring you in here. Thank you so much. I understand it's quite late there, is it, in Germany, Dr. Burkhardt?
Yes, actually, it's almost 11 o'clock now.
All right. Well, we are very grateful and very thankful that you're here. Dr. Burkhardt, we'll begin. And Dr. Michael Palmer, thank you very much. You're going to be sort of assisting with any, you understand the work of Dr. Burkhardt is sort of your role, and you're going to be assisting with any parts that maybe Dr. Burkhardt needs any further explanation with any difficulties with the English language. Dr. Burkhardt, tell us, sort of maybe place us in the story, how this began, how you discovered some amazing things after you began doing work as a coroner and were asked to do autopsies on certain individuals that had died. Tell us about that in your own words.
Well, actually, in the beginning, we thought this was an easy job because other pathologists or coroners had looked at these autopsies, and they all had the impression that this was a natural death. But when we started to look at the histology, and I did this first alone, but then another pathologist joined me, and now all these sections have been seen by many other colleagues and pathologists, mainly not from Germany, but mostly from other countries. And we all agreed on many of those features that will be shown in the next presentation. And we were so alarmed by these findings, especially by the findings lesions of the small vessels and the large vessels, that we did not think we could wait until all this is finished, but we're actually in an ongoing investigation into this, and we find the things are so alarming that it is absolutely mandatory to go to the public right now.
Wow. And so you say there were alarming things. What was the first thing that began to concern you?
Well, when we started, actually, myocarditis was the main object that we were looking for, and actually we did find it. But then we saw vascular lesions, lesions of the small vessels in the heart, in the lung, and most recently also in the brain. And these lesions were in the small vessels, but also in the larger arteries, and most alarming in the main aorta. And we have 5 cases now that died of rupture of the aorta. And in all cases where the aorta was histologically examined, we found some structural alterations that seem to be very alarming, even if
Wow.
it did not rupture.
So
And
would
we
you
will
say
have
it's
something.
because of, right, would you say it's because of your experience? You understand what a body looks like, and what it would look like after death, certain parts of the heart. You are very familiar with that. So when you were seeing these things, that was raising the alarm for you.
Yes, yes. Well, actually, I've been in pathology for more than 40 years. And when I started my education, the autopsy was one of the main things that the pathologist learned. And in all my life, I may have seen more than 40,000 autopsies. Now, I did not perform them all by myself, but I looked at the slides, I looked at the diagnosis, and so I think I have quite some experience in judging what is normal and what may be an artifact by autolysis and things like that.
Mm. And Dr. Palmer, just to get your input here, you are familiar with the work of Dr. Burkhardt. Would you say that this is a man that can be trusted, that this is somebody who truly understands the body?
Oh, well, I mean, if I didn't believe that, I wouldn't be here with him.
Yes.
Yeah, so I'm not a pathologist myself. I'm an MD by training, but even as an MD, you learn a little bit the basics of pathology. And I think there is enough in the work of Dr. Burkhardt, which I do understand a sufficient level of depth that I am confident that his work is very solid.
Yes. And Dr. Burkhardt, before we get into some of your significant findings, have you faced any backlash from people who want you to be silent, or have you faced any criticisms from your colleagues?
Well, I received some criticism. I was especially invited in other European countries like Bulgaria, Italy, and I shared slides and pictures with pathologists in Sweden and Austria. There were some criticisms, and I corrected some of my things, but all in all, they all agreed on what we see, what I saw, what we saw.
The evidence is in, is what you're saying. So we would love to hear from you. I absolutely 100% trust that you would know after all of those autopsies. If you are seeing something that, as you call it, alarming, then I believe that is information that the whole world needs to know so that we can understand what is actually going on. So please feel free to, I know we have some slides and anything that you'd like to share us of what your findings were.
Yes. I think we have prepared presentation by PowerPoint, and we can go through this, and I will try to explain what can be seen in the histology.
Thank
Okay,
you.
yes. Okay, so I will just take care of the text slides here, so we can focus on some
The
key
first one.
questions. The first one is, what happens in general? What is the mechanism, the underlying mechanism of the damage caused by the vaccines? Then we may ask, for how long would this damage be observed, right? Many people focus only on the first 1 or 2 weeks after the vaccination. Is that really correct, or could it be that we see ongoing damage and progress for a longer period of time? Then what we do know from the vaccine adverse event databases is that many diseases based on blood clot formation are observed, right? Heart attack, stroke, deep vein thrombosis, lung embolism, and so on. How can we understand how that comes about? And finally, how can we be sure that the damage that is observed in these autopsies is indeed connected to the vaccination? Next slide, please. Okay, so as Dr. Burkhardt already alluded to, right, he's not on his own. There is an international team of pathologists involved, and he has, I don't even know the exact number of autopsies that he has looked at now. This may be a little bit dated, what I have here, but a good number of autopsies was evaluated by routine histology and staining, and a smaller number was examined using immunohistochemistry. What that exactly is, we'll see later on. Also of note, right, of the 15 most thoroughly characterized autopsies, right, 7 concerned men and 8 women. There was an age range. Most people were elderly, but there were some younger ones, the youngest 28 years old. And the deaths occurred between 1 week and up to 6 months after the most recent vaccine injection. So that's quite a range. And among those deaths, all 4 major manufacturers of gene-based COVID vaccines were represented. Do you have an addition, Arne? No? Okay, next slide, please. Yeah.
Well, I would like to stress that this is an ongoing investigation.
Yes.
So
Right.
the numbers change every day. Actually, today I got 2 more cases, and they are not included now. So,
Yeah.
so if you look at the numbers, they may change according to the collective that I present.
Yes. Okay.
So,
right. So, but it is
15
clearly
cases have been really thoroughly investigated.
Yes. Okay. So of these 15 thoroughly examined cases, right, these had initially been autopsied elsewhere, and in each of these cases, the deaths had been ascribed to a natural cause or simply classified as of uncertain cause. And Arne's and colleagues' subsequent investigations found that in the majority of these cases, death due to the vaccine was either highly likely or at least fairly likely, and only in a single case was a causation ruled out altogether. Next slide, please.
So if I may just say, this is about 80% of the deaths that are connected with the vaccination. And there's one other autopsy study in Germany at a university institute, and they come to the number of 30%. So, but as I said, we have a selected collective because these were all people that were extremely healthy to as far as the relatives judged.
Okay, and the relatives were suspicious of the vaccine causation, so that also brings in a certain bias. Okay, so what we have here is an overview of where exactly those deaths occurred, and I'm not going to read all of this to you. The key point here is that in most cases, deaths occurred outside of a hospital setting. Only in 4 cases did death occur in the ICU. Why is that important? Because prolonged ICU treatment that typically is administered to people with multiple underlying disease conditions, and also receiving multiple treatments and so on and so forth. And so this might obscure the general picture also for the pathologist, right? So in most of these cases, there were no such major complicating factors. Next slide, please. Okay, so I will take care of this one, Arne, if you don't mind. This is just for the general background. This is just a general background, right? So what an histologist does, or a histopathologist does, he takes tissue sections, but he just doesn't look at them right there, but he first treats them with a mixture of synthetic dye stuffs. And the reason for that is, right, the purpose of that is to generate contrast and to highlight specific cells and cell structures, right? For example, here we have this cross-section through a healthy liver. Okay, the empty spaces, they are normally filled with blood. This has been washed out here in this case. We see a cell nucleus, and we see in some case also the demarcation lines between individual cells. Not always, but it's also not so important. We do see quite a bit of stuff here. Okay, so I guess from here on I will let you take it away. Next slide, please. Okay, maybe I can take care of this one as well. So the fundamental mechanism of vaccine-induced cell damage. Okay, so what happens is that first the cell in question will take up a vaccine particle, right? And this often concerns endothelial cells and blood vessels. So the endothelium in a blood vessel is the innermost thin cell layer, and this will take up the vaccine simply because it's directly exposed to the bloodstream where the vaccine particles are circulating. Now, each cell, for example, an endothelial cell that has taken up the vaccine particle will then express the spike protein gene that is contained in these vaccine particles. And the spike protein that is being synthesized will then be taken to the cell surface. And the spike protein on the cell surface will then be recognized by lymphocytes, both by B cells and by T cells. On the right-hand side, you see what a lymphocyte looks like a little blue ball, essentially, right? And you will see many of these very tiny blue dots, lymphocytes, in the subsequent pictures, right, which will be taken at lower magnification. Okay, so this cell attack, right, by the lymphocytes, by the immune system, will cause cell death, and you will see ample evidence of this in the following slides. Next slide, please. Okay, Arne, that's for you.
There you see on the left side a normal small blood vessel in the myocardium, and you can see that the vessel is lined by a wallpaper-like layer of endothelial cells. You actually only see the small spindular nuclei. The cytoplasm is almost not seen. It's just a tiny red line. And on the right side, you see a small vessel of the same type, which is completely destroyed. And you can still see in this mixture of cells that there are spindle cells. These are the endothelial cells that have been damaged, apparently, and discriminated from their background, and also as a proof that this is an intravital process. You see dense infiltration by lymphocytes. These are the small black dots in between. The elongated cells are the endothelial cells, and the dots, the small black dots, are the lymphocytes. So this small vessel has been completely destroyed. Next slide. So it's not only the small cells, small vessels that are damaged, but we have many changes in the larger arterial vessels, like here in the aorta. You see this is a cross-section of the aorta. On the right side, the blood would have been flown and you see there's only slight arteriosclerotic changes, but you have right in the middle, there's a destruction of the regular arrangements of the elastic fibers and the myofibroblasts that form them. And again, to prove that this is a intravital process, you can see that there are lymphocytes. These are the small dots that you see around these small slit-like structural defects. Next slide. And here you can back. Here you can see another case of the aorta, and you can see again on the right side the blood would be flowing, and on the left side the retroperitoneal tissue would be, and you can see that as in the picture before, you can see structural defects in the organization of the elastic lamella, but in addition you find a dense infiltrate of the small vessels that care for the aorta, the so-called vasa vasorum. So again, the dense lymphocytic infiltration makes it very clear that this is intravital process with structural defects in the arteries. Next. And this is just a scheme how you may find an aneurysm that may rupture, but in some cases the dissected blood vessel finds its way back, and this is called a dissecting aneurysm. Next slide. And this is a case of a ruptured aorta, a man who died from bleeding by a ruptured aorta, and you can see that what I showed before, that there are two layers of the vessel is here clearly to be seen. You see on the top would be the blood flow, on the bottom it would be the retroperitoneal tissue, and you can see there's a clearly lined double wall, and inside there's black material, which is the blood that has been fixed. And the next slide shows you that not only the large arteries are affected, but also smaller vessels here in the brain. You can see this is a 28-year-old man who died of a subarachnoidal bleeding, which was apparently caused by a diffuse damage of the small arteries. You can see this this artery with a dense infiltration, and no aneurysm could be found. So this is apparently a diffuse damage of the small brain arteries. Next. And in some cases, this is myocardium. You can find that the endothelial changes lead to a reaction, and in this case, total obliteration of a small artery. Next slide. And for those who are not so familiar with histology, this is a woman who was very fit and participated in marathon runnings until she was vaccinated. And here you can see the results of changes in the arteries, and you can see that definitely there's the perfusion of the feet are definitely damaged, and she can only walk for small distances now. And in the next slide.
So that person is not dead, Dr. Burkhardt. That was just damage to her feet after
Yes,
getting vaccinated.
yes,
You could see the damage. Yes. Okay. Okay.
yes. And no, there was a biopsy taking from the skin and muscle of the leg, and we did find obliterating vasculitis there, what the pathologists would call paniculitis.
Okay. Oh, we can't hear you,
So,
Dr. Palmer. I think you went mute. I think Dr. Palmer's going to say something.
Yes.
yes.
Sorry. Yes, I indeed muted myself.
No
So
problem.
the clinical findings that Dr. Burkhardt just illustrated, they correspond to the pathological findings illustrated in the preceding slide, right? He showed first the tissue structure. In the tissue section,
Yes.
an artery that had been completely blocked off, right? And if that happens to multiple small arteries, then the result will be that you have completely disrupted perfusion, for example, of the toes and the feet or the legs, as was shown in this woman. Okay, so here we have the summary of the effects on the blood vessels, right? So as discussed earlier, the endothelial cells are particularly prone to take up the vaccine from the bloodstream, right? Therefore, to express the spike and to be attacked by the immune system. And once this happens, right? The endothelium is all that prevents the blood from clotting. So each time you have a destruction of the endothelium, you have to expect that blood clots will ensue, right? So this is the plausible connection between the vaccine damage and the blood clotting, which is the widespread, simply the destruction of those endothelial cells. There are other avenues that can make this connection, but this is a very straightforward one. Then the limit or the expression of the spike protein is not limited to the endothelial cells. We see the same apparently also in the muscle cells of the aorta, for example. Now the aorta, as the main artery of the body, right, it is subject to very strong mechanical stress, right? It receives the blood that is forcefully expelled from the left ventricle. And if we have an aorta that is pre-damaged through inflammatory lesions, then it will simply not stand up to this repeated mechanical stress, and this will induce rupture, right? So the inflammation weakens the structure of the aorta, and then the action of the heart will simply do the rest and cause the dissection or the rupture. Okay, I think so. And then on top of that, as just discussed, we have the obliteration in some cases of blood vessels. This might occur due to the conversion of an initially formed blood clot into connective tissue, or as Dr. Burkhardt suggested, through a direct proliferative inflammation, if I understood that correctly. Maybe Arne, you can correct me if that's needed.
No, that's correct, yeah.
Okay, then next slide, please. I think that's back to you.
Well, here you can see a typical myocarditis in a vaccinated. On the left side, you see the typical intact, normal heart muscles. They run parallel, and on the right side, you can see that they are densely infiltrated by cells, and these are definitely not granulocytes as in infarction, but they are lymphocytes, and this means this is a immunological attack, an immunologically mediated destruction of myocardiocytes.
Yeah. Next slide, I think, yeah.
Yes, and here you can see another important finding, that is the accumulation of lymphocytes also in other organs, in non-lymphatic organs. On the right side, you see the normal lung tissue, and on the right side, you see these nodular infiltrates by lymphocytes, preferentially around small vessels. And you may find this now and then in normal lung, but we found it as a rule in almost all of the lungs that we examined. So this is a sign that there is some lymphocyte activation and with the danger of developing autoimmune disease.
Yeah.
And here you can see a lung which is only has very little air inside anymore because that's inflammation. And on the right side down, you can see these small lymphocytic structures, which are actually small lymph nodes that developed in the periphery of the lung. Now, in the central areas of the lung, this may be not so alarming, but you can see on the right side is the pleura, and this is definitely in the periphery of the lung. And there's follicle formation. Also, in many cases, we found an infiltration of lymphocytes of the thyroid glands. You can see a normal thyroid gland on the right with these follicles filled with thyroglobulin, and on the right side you can see this is a typical destructive autoimmune disease of the thyroid, which is connected with the name of Hashimoto.
Okay,
And
good. Yep. Right.
no,
So
go ahead.
okay, good. So a summary of the findings that we see in organs, not just in vascular structures, right? We see in several vital organs, in the heart and the lung, we see lymphocytic inflammation. In the heart, we call it myocarditis. In the heart, we call it alveolitis, but the underlying mechanism is most likely the same. Again, expression of the spike protein antigen in the cells of those tissues and the attack and destruction by the immune system. And we see in the heart the destruction of the muscle fibers. And it was interesting to note that this was not limited to young people only, right, Arne? If I get you correctly, you see this also in people of advanced age. I could imagine that in some of the cases that we see in the adverse event databases, that myocarditis with sudden death in elderly people is misdiagnosed as a heart attack, because that is much more common in other circumstances. And
Yes.
we do see, right, for example, in the lung, Arne showed us these lymph follicles, which normally should only occur in lymphatic organs such as lymph nodes and the spleen, which points to a very strong activation of the immune system. So it is quite striking that at the same time that we have this excessive activation and the excessive aggression of the immune system against body cells, we have clinically immunosuppression. So we have reactivation of viruses, such as, for example, the shingles virus, which we call herpes zoster or shingles, right? The chickenpox virus. That is one indication. So it appears that the immune system is kept so busy with attacking the body itself that it has no attention span left for defending against proper pathogens that might intercede, right? Okay,
Wow.
I think that's enough about this. Maybe we can go on. Thank you. Yes. So we now move on to one very important question, and that is, how can we really be sure that the inflammation that we see all over the place is indeed caused by vaccination, right? I already mentioned the interpretation that this is due to the expression of the spike protein in those tissues, in those cells that are being attacked. So how can we be sure that that's indeed the case? And Arne actually developed a methodology for detecting the spike protein. The general approach is known as immunohistochemistry, right? So what we really do here is we use an antibody that specifically recognizes the spike protein, and then with some subsequent processing stages, we can make sure that everywhere that the spike protein is found, we can generate some brown stain, some brown pigment that indicates visually where the spike protein is to be found. Now, the next question then is, if we do find the spike protein expressed, is this really due to the vaccination, or could it be that these people were indeed infected with COVID? Now, there's also a way to sort this out, because in a proper virus infection, all viral proteins will be expressed, right? And besides the spike protein, another very abundant viral protein is the so-called nucleocapsid protein. So these are the two major structural proteins of the virus. And in a natural infection, we should expect that both the spike protein and the nucleocapsid are expressed. So the presence of the nucleocapsid would serve as an indication of a natural infection, whereas the presence of the spike protein only in the absence of the nucleocapsid would indicate vaccine damage. Okay. So can I have the next slide? I think this is just a general, I think we will actually skip this for brevity, just simply for an illustration, right? In the top right, you see some cells that have been made to express the spike protein by exposing them to the Pfizer vaccine. And accordingly, they do get stained with this brown pigment, which is developed downstream of the recognition by the spike protein specific antibody. Okay, next slide, please. And I think I will leave it to you, Arne.
Well, first of all, we did prove our immunohistochemistry on cell cultures, and after that, as is shown here, in infected lung, in infected nasal swabs, and in the cells that were exposed to Comirnaty vaccination. And you can see that the nuclear capsid is definitely expressed in those people who have the infection, but it is not expressed in cell cultures that have only been exposed to the vaccination.
Okay, very good. Next slide.
And on the other hand, the spike protein, we also tested this in cell cultures, and of course with negative and positive controls. And you can find here that actually on the left side is a positive reaction for the spike protein, which is definitely located at the endothelial cells, that it's the small vessel cells, and it's absolutely strikingly positive. And on the right side, you see the negative control with the nucleocapsid, which is negative. Next.
My goodness.
And we could also show that actually it was true what the companies said about the production of the spike protein. Actually, we could show that it was produced locally in the deltoid muscle, but it's very important and actually sensational. We could show it in all kinds of lesions, which will be shown yet now.
Okay.
Next. So this is, for example, on the left, a small arteriole in the heart muscle, and you can see this definitely very specific staining of the inner circle, most of this smaller arteriole, and you can see the endothelial cells are partly desquamated, and also the endothelial cells of the capillaries are definitely stained brown. So this is a sign that there is the action of this toxic spike protein relevant for these small arteries and vessels. And we can also show this in the cases that I showed you of the aorta, which was disrupted, and you can see that there are many cells which are definitely positively stained. And again, of course, we always do negative controls. Nucleocapside was negative, and so definitely the spike protein, and this is a toxic agent, apparently interferes with the cells of the aortic walls and makes structural damage. And this is a very interesting slide, because you have two organs here in one block, and you can see on the bottom the liver, and on the top the spleen. You can see that the liver does not express spike protein, almost none. If you look exactly, and there are some small circular structures. These are the small vessels of the liver. They are positive. But then on the top you have the spleen, and the spleen is diffusely positive, and especially the small arteries of the spleen are pronounced positive. They are black. These are the black circles that you see. Next slide.
Okay.
And we have this phenomenon that we call onion skin arteriolitis of the spleen, which we see in autoimmune diseases like lupus erythematosus. And here you can see one of these small vessels, which has an onion skin alteration, and you can see that the spike protein is definitely expressed here, and apparently mostly found with the elastic lamella. Next. And here we found a very strange phenomenon, because apparently these small vessels in the spleen are damaged and have small gaps. And in these gaps, the proliferating lymphocytic follicles are pushed into the vessels. This is a phenomenon none of the pathologists that I showed it to, and this is about 50 pathologists by now, have never seen this before. Now it is known that during infection and immune reaction, the pressure in the spleen is enhanced, and the spleen sometimes is enlarged, but only to a certain degree, because the capsule of the spleen is non-elastic. Next. Then we have seen some enlarged lymph nodes, but where we did not think this was a malignant lymphoma. We call this a pseudolymphoma, which is probably due to a extensively reaction of the lymphocytic tissue. Now here you can see this is a gastric biopsy of a man who's still living, and he was vaccinated 3 times, and they did a gastroscopy because he had some gastric problems, and they found a strong infiltration of the whole gastric mucosa by lymphocytes. And in one location, there was apparently a nodular structure, which they biopsied. And you can see here on the top, you can see the small, the surface of the skin, and in in the deeper layer, you can see a quasi-nodular structure, which is shown better in the next slide. And here you can see we have done immunohistochemistry for the spike protein and the nucleocapsid. The nucleocapsid is all negative. The spike protein is negative in the nodular malignant B cell lymphoma, but the infiltrating lymphocytes surrounding this B cell lymphoma are definitely strongly positive for the spike protein. Now, this is a case where you can make a lot of thinking about how this could be connected, but it's a finding that nobody else so far has documented. Next.
Amazing.
And finally, some changes that we see in the brain. And you can see here I marked where we found changes by the red arrow stars, and
Okay.
mostly the arachnoidea, which is the loose connective tissue surrounding the brain. The brain is affected, and we can show, next slide, that we found lymphocytic infiltration also in the brain and also in the heart dura mater and you can see on the left side, this is a normal dura mater, the dense structure, and you can see this lymphocytic infiltration here. Next slide. And this is a 28-year-old man and you can see on the right side a distended vessel with disruption of the walls and lymphocytic infiltration, and he did not have an aneurysm, but he died of subarachnoidal bleeding, apparently by diffuse damage of the small brain vessels. Next. And after that, we looked very closely at all the cases where the brain was taken out, and actually slightly lymphocytic infiltration of the small vessels of the brain is a very common finding, and very often there is some kind of iron deposition on the right, and you may see something brown that is iron. So there was a bleeding in the vicinity of this small artery. Next. Next slide. So finally, one very interesting case of a man who died after triple vaccination, 76-year-old, injection AstraZeneca and Pfizer, and the death occurred 238 days after the first, 150 after the second, and 18 days after the third injection. And histological finding at autopsy was necrotizing encephalitis, vasculitis of the aorta at the coronary artery, of the same way as I have showed, and also mild lymphocytic myocarditis. Next slide. Here you can see the necrotizing encephalitis, which probably only those who are familiar with histology can see, but you can see the lymphocytic infiltration in the death tissue. And the next slide shows you now that we can show that the spike protein is definitely expressed by the neural cells and by the endothelial cells and the nuclear capsid is not expressed. So this is proof that this is actually a sequence of the vaccination. Next.
Wow.
Here, but in a larger magnification, you can see that there are some neural cells which are positive, but especially the endothelial cells of the small vessels are positive. Next. Here you can see the neural cells that are positive. So what we found in the brain was this one case of a transfection-associated encephalitis, and we have this lymphocytic infiltration and destruction of intracerebral supraarterial blood vessels, hemorrhage without aneurysm, focal lymphocytic infiltration, and in one case a partial necrosis of the hypophyseal gland. Next slide. So I come to some resection material and biopsies of living persons. So one very strange finding made by another pathologist was that in appendectomy material that he received, often there was no classical appendicitis, but there was a periappendicitis. And the next slide will show you. And this is the fat tissue around the appendix, and you can see there's a dense lymphocytic infiltration, periappendicitis. And again, in this case, we were able to show that these small vessels in this area express the spike protein. Next slide. Here you can see the small vessels lined out very clearly. It's the endothelium that is positive. Next slide. Larger magnification, you can see the endothelium is very specifically stained. Next slide. This is a bronchial biopsy in a young man, a student 9 months after the injection, and he had constant trouble with his lung, and so they did a biopsy, a bronchial biopsy, and you can see the results here. It's very strange that the interepithelial dendritic cells apparently express specifically the spike protein. And also in this case, the nuclear capsid was negative. Next. And finally, we come to the question, how can some of this material actually get into the system? The WHO in 1916 declared that you do not have to aspirate to prove whether you hit a blood vessel or not, and they said you can leave this as these small vessels are too small to be injected, but this is definitely wrong, and we could show this here. You can see the needle superimposed on a slide of the deltoid muscles, and you can easily see that it is absolutely possible to come to a direct injection of the vaccine material with all its components. I think this is one of the last slides, so please read the summary.
Yeah. Right. Okay, I will do so. But just one comment to the preceding slide. Right in the middle of the preceding slide, you actually saw a blood vessel, and what the slide was supposed to show is that the needle would fit comfortably into that blood vessel, so it is perfectly possible, right? So this red structure in the middle, it's the blood vessel. It's filled with blood, and the needle, if you just push it a little bit further, would fit comfortably into the blood vessel itself, so you could deliver the injection into the blood vessel without problem. this is exactly that makes the point that Arne just stated. Okay, so just to sum up the entire talk, right, we have seen that lymphocytes are found all over the place, right? Even if you didn't recognize every detail, you could see plenty of these little blue balls everywhere, right? These are the lymphocytes being on the march that are attacking the cells that express the spike protein. And if this happens inside blood vessels, right, then the destruction of the endothelial cells will cause blood clotting, okay? And we see from the immunohistochemistry that this is triggered indeed by the spike protein expression, right? We find the spike protein expressed in the same places where we also find strong inflammatory changes. For example, the wall of the aorta, right, was a key example. There were several cases of aortic dissection and rupture, and we do see in those cells in the aorta vessel wall the clear expression of the spike protein. We see in some cases, shown was only a thyroid gland, but similar findings were also made with salivary glands. Cases that resemble true autoimmune disease, that is possible that the excessive long-standing stimulation of the immune system indeed gives rise to true autoimmunity. This is indeed a known phenomenon in general. A striking feature is that the spike protein expression and inflammation can persist for many months, right? The most striking example being the bronchial biopsy, just shown a few short slides ago. Even 9 months after the most recent vaccination, you still see strong expression in some cells in the mucous membranes in the bronchi. That is a very striking finding. I mean, consider that you were being told, right, after the injection, you will have a short expression of the spike protein that is limited to the injection site and only of short duration. What you see here is you have expression of the spike protein all over the place, and it lasts for many months. That is certainly a dramatic finding. Okay.
Wow.
And I think, yes, so I think that is, so we do see a consistent picture of long-lasting and widespread spike protein expression with strong autoimmune-like reaction by the body and all kinds of secondary pathological manifestations.
Amazing. I just want to thank you, Dr. Burkhardt, for your amazing work. I have a couple questions. Were most of these, the things that you're finding, is it mostly Pfizer or is it AstraZeneca? Is it also Moderna? Were you able to categorize by which vaccine people received?
Yes, well, most changes, most damages we actually did see with the Comirnaty by BioNTech Pfizer, but we also saw it for vaccines.
I think that is probably simply because Pfizer is the most widely used one in Germany as well, many other countries as well.
Yes, might
right.
be.
Yes, but you still saw it in the other vaccines as well. And
yes.
Your work is so phenomenal. Clearly, like you said, if you hadn't been required to look into this deeply, you would not have this knowledge. And this is transformational in understanding what's going on at a molecular level. So are other pathologists and other coroners across the world, are they at all cooperating to bring this very amazing data and science to those that need to know this?
Well, there's a great interest in our work outside of Germany. In Germany, there are the associations of pathologies, 2 of them, and they practically ignore what we do. But as I was invited in Italy, in Bolzano, Verona, in Bulgaria. I'm now asked if I will appear before the great Grand Court of Malta. And so there are many interviews in this respect.
That's wonderful. We need that. And do you, after seeing all of this, what do you recommend? Are you literally, the evidence shows we should stop the use of these vaccines, that they are causing extreme harm. That seems to be what's happening. These spike proteins, you can see the difference in what should be a regular looking body cell, whatever you would call it professionally, but you can see the difference. So clearly people are being harmed at this point.
Well, definitely this vaccination campaign has to be stopped and thoroughly investigated, and all the adverse effects have to be examined, and actually every death occurring in timely connection with the vaccination should be examined. I mean, if you can implement vaccination Verpflichtung,
Mandate.
obligation for vaccination, you can also implement an obligation for autopsy.
Right.
I think this is very important.
Right. And these should be being done. I believe I've heard that they were not doing any autopsies. It was kind of like a rule in the United States of America, and I believe in Canada as well. And they would say, well, we don't want to get the virus spread through the autopsy, you know, but instead of actually wanting to know the science and wearing your PPE or whatever, but by the way, most people have had COVID now. So this is just a joke to be feeding these vaccines that are harming our young people, especially. You know, now they want to give it to 6 months old, you know?
Yes, well, this was one of the alarming signs for me that actually in Germany also they tried to forbid autopsies in COVID cases, in vaccinated cases. Excuse me.
Yes, that's okay. You can have a good cough. I would just say, and Aaron, you can put it on mute for a second for him there. But I would just say that this is some of the most profound work and evidence that the world needs, and it should be being acknowledged, and we should be seeing doctors and governments and leaders. Go ahead. You know, Dr. Palmer, yeah, we should be seeing the rollback, right?
I can only agree with you. I think this work is fundamentally important. It is crucial. It is absolutely essential work. And I really admire Dr. Burkhardt. I mean, he is basically well into retirement age, that he comes out of retirement and really puts out himself the way he does. You know, I mean, he spends long hours doing all this work under not so very easy conditions, right? So, and he has the courage to really speak out publicly, and he just pulls no punches. And you see that he is.
Dr. Burkhardt, do you think?
Top expert. I mean,
do you think that everyone whose loved one perhaps dies of uncertain circumstances, they need to demand an autopsy? Would you say that's the case?
Yes, certainly.
Yes.
Yeah, that's a very good point. It's a very good
I
point.
think that we need to see that worldwide. What can we do to ensure, like, people here that are watching today, they could take this show that we've done here, and they could pass it on to coroners in every city across North America, so that people are, being educated, because a lot of this stuff, we look at it and it's like really cool to see the cells and all that. But when a pathologist looks at your work, they're going to instantly know what is happening.
Yes, definitely. And as I always stressed, I'm open to everybody who's interested in my slides. They can come.
Yes.
I will discuss
Yes. Yes, I'm sorry you have such a cough there. My
Yes.
final, my final, my final comment and question would be: is there anything that can be done to turn around if somebody has had the vaccine? Do you believe that this damage is permanent once it enters someone's body? It's very sad to ask this, but is it permanent before they die?
I think there's a
Well,
broad range of severity. I think there's a broad range of severity. I don't think that everybody who got injected has to be afraid that they will have intense inflammation for the rest of their lives. It is also, I mean, it is inflammation. This is not the first time that we are dealing with inflammation. So I think what is required are some clinical physicians who face reality and have some courage to try treatments. I mean, there are treatments for inflammation. One has to take a risk here and try some of the treatments for inflammation that are available and see what works, what sticks. I mean, the first step is to actually have clinical physicians acknowledge that there is such a problem. I mean, one problem is that I just talked to a naturopathic doctor here at Waterloo in the weekend, and she told me she wasn't even allowed to raise the topic of possible vaccine damage with patients who come to see her and in whom she does suspect vaccine damage. She is not permitted by the college to even bring it up to them. I mean, what kind of medicine is that?
Tragic world.
I mean,
what is
what kind of
happening?
medicine is
It
that?
makes
That is
you,
crazy.
yeah.
So I think that, I mean, if we have courageous pathologists, we have several courageous pathologists, we now need courageous clinical physicians who, just like Dr. Paul Merrick did and others did, Dr. Pierre Corey, and they invented the protocols for early treatment of COVID infection. Now we need the same courageous approach for the treatment of vaccine damage. People need to face up to what's going on. I think they can also make use of Arne's findings. They can better understand what might be going on in those cases with diffuse signs of inflammation, and they might use their toolbox and try to see what works. That's what's needed now. I think it's up to the clinicians now to try our treatments.
The greatest thing, Dr. Burkhardt, I'll give you the final word, but the greatest thing would be if we can learn this so that we can find like an antidote or something that could help people. Because if I was vaccinated and I was watching this, I would be very afraid. And I'm afraid because my family members, my loved ones have already accepted this vaccine. And it's very difficult to swallow. And I think we have a problem because people don't want to see the truth because it's so scary. But if we could find antidotes, if we could find the way to treat before we get to this place, stop the vaccines and start the treatment now.
I think that the severity of the side effects and even death in some cases largely is dependent on the percentage of the vaccine that is actually coming into the organs system. So this is somewhere between 1% and 100%, and you may even, I have the suspicion that in many of my cases that I looked at who died, that they got really a large dose of the vaccine and its components right into the blood vessel, and it was spread in the whole body. And certainly, and I hope that there is some way for the body to deregulate, maybe even the structural changes in the aorta could be somehow healed out. I don't know how much scarring is possible in this area. And definitely the body might find ways to downregulate even the autoimmune phenomena. But this is something that we do not know right now. We only know it lasts longer than we ever thought. And as far as an antidote, unfortunately, as a pathologist, I cannot help that. This is something for the pharmacists, for the medical profession.
Yes, sir. I just want to thank you so much for your work, for what you are giving humanity, for the truth that you are telling that will be helpful in stopping this assault against mankind. You are a hero, and I thank you. I'm sure you would rather be sitting back and taking it easy, and yet you're working so hard. I thank you from the bottom of my heart, sir. It is something to witness the work that you are doing, and I just bless you for that. And I hope that if you're having more findings, that we should do this again as well.
Yes, yes. We will definitely have more and better founded results in the very future.
Yes.
Thank you very much.
Thank you. Thank you, Dr. Burkhardt, and thank you, Dr. Palmer, for your time today.
Yes, thank you. Thank you. Thank you.
Be blessed, both of you. Thank you.